Our last topic is a real fun one, disorders of the digestive system beginning with the oral cavity. Periodontal disease is the most common cause for loss of gums. This would mean not going to the dentist every 6 months, not getting your teeth cleaned, and having bleeding and infected gums, gingivitis, inflammation of gums. This can eventually lead to the loss of the tooth, which then leads to loss of the bone below the tooth. Yummy. Mumps are an infection of the salivary glands, usually the parotid glands. It's a viral infection. There is a vaccine, the MMR vaccine, given after the age of 15 months to prevent this disease. An anti-vaxxer could allow her son to get this disease and become sterile. Not only does it affect the salivary glands, but it may affect other organs such as the gonads, and it can cause sterility in post-adolescent males. Here is a child with mumps. Esophagitis is inflammation of the esophagus, often from stomach acids from below, from a relaxed lower esophageal sphincter. Gastroesophageal reflux is backflow of stomach acid into the esophagus, and this results in heartburn. Esophagitis seen with endoscopy. The liver can have a lot of problems. This person has jaundice. It's caused by a buildup of bilirubin, which yellows the skin and eyes. A person could have hepatitis, which can be caused by alcohol, drugs, or infection. Cirrhosis is hepatitis characterized by degeneration of liver cells and replacement with scar tissue. So the scar tissue is no longer functioning as liver cells, and the result of cirrhosis is death. Viral hepatitis A, B, and C, and there's other viral hepatitises, and these destroy liver cells, can cause inflamed, tender liver and high fever. There is now, we have vaccines for these. There is now a cure for hepatitis C. So things are changing in the viral hepatitis area. Here is a liver with cirrhosis. Before a liver becomes cirrhotic, it could be a fatty liver, like say with drinking alcohol. The liver tissue becomes fatty, but if a person stops drinking, that fatty liver will go back to normal. It won't continue to cirrhosis. Gallstones may be a problem. These are crystals that form when the bile becomes too concentrated, and the gallstones will hurt when they go through the bile duct. Really small ones may be excreted with no problems. Larger ones, and these are pretty large, you will feel these passing through, and it will be quite painful. If you pass a gallstone and go to a doctor, they will probably send you to a surgeon who will recommend surgery instantly, but that's not always necessarily the case. Sometimes there was just 1 or 2 stones. Maybe the whole gallbladder is not infected, and possibly a change in diet could prevent you from having more gallstones in the future. Cholecystitis is irritation and damage to the gallbladder wall caused by gallstones too large to pass. So the gallstones can block ducts, and this would result in surgical removal of the gallbladder. Now, bile continues to be produced, and it may be stored temporarily until it's used. Gastritis of the stomach is inflammation of the mucous membranes. Different causes: ingesting drugs such as aspirin or alcohol, stress, bacterial infection, chemicals. An ulcer. Ulcers form when gastric enzymes and acids erode through the stomach or duodenal lining. So a gastric ulcer is a peptic ulcer in the stomach wall, and a duodenal ulcer is a peptic ulcer in the duodenal wall. A bacterial infection by Helicobacter pylori is responsible for over 80% of peptic ulcers. So when you have an ulcer, you need an antibiotic if H. pylori is present. It's a simple test. They just test your carbon dioxide that you exhale. So gastric ulcers are painful because it's eroding the mucus layer on the stomach, and so every time acid washes over that plain layer of tissue, it will hurt. Pancreatitis is obviously inflammation of the pancreas due to duct blockage or viral infection or drugs, including alcohol. And the injury to the pancreatic cells activates the lysosomes. And so these digestive enzymes are released within the cell. In about 1/8 of cases, death occurs when the digestive process does not stop. That is, those lysosomes are opened up until the enzymes completely destroy the pancreas. In the small intestine, you can have enteritis, inflammation of the intestine, usually referring to the small intestine. This causes diarrhea, and one cause is infection by Giardia lamblia. You get Giardia lamblia by drinking water out in the mountains and the woods. You think it's beautiful, clean water, but most of the water in the United States is affected by Giardia lamblia. Dysentery is inflammation, usually caused by bacteria, inflammation of the small and large intestine, producing diarrhea containing blood and mucus. And you'll die pretty quickly of this unless it's treated. You're just losing a lot. And there's a picture of Giardia, magnified 4,000 times and using a scanning electron microscope. Gastroenteritis is inflammation of the stomach and intestines due to a pathogen, often in areas with poor sanitation and low water quality. The large intestine colitis is inflammation of the colon, often with diarrhea or constipation. I talked to a doctor in a poorer country, and he said because food is often so contaminated with bacteria that people have alternating bouts of diarrhea and constipation. So their colons are never normal. They're always having issues. Colorectal cancer, aside from skin cancers, is the third most common cancer in the United States, affecting both men and women, usually over the age of 50. Risk factors include a diet rich in animal fat and low in fiber. Inherited disorders may also promote the formation of epithelial tumors. So if you were to look inside the colon, you might see small polyps. The prognosis is greatly improved if the polyps are removed before metastasis. And this is why people go and have a colonoscopy, to catch these polyps when they're small, to cut them off so they don't grow into cancer. Many of these are very slow growing polyps, and it's taken years to get to be that size. Which section of the small intestine is lined with lymphoid nodules? The ileum. What hormone stimulates stomach activity? Gastrin. Which hormone stimulates the liver to secrete more bile? Secretin. Which of these is the major stimulus of the defecation reflex? Mass peristalsis in sigmoid colon. Which of these is the digestive function of the liver? Bile salt synthesis. Which of these is not a component of saliva? Hydrochloric acid. Which of these is triggered by CCK or cholecystokinin? Dilation of the hepatopancreatic sphincter. Which of these borders the pulp cavity of a tooth? Dentin.